So our general approach to when we're thinking about ADHD is not just one thing. It has a biological component, which is that we don't necessarily know, there may be a genetic component, so that we'll find, when we find an individual child with ADHD, there might be family relatives, might be siblings who have ADHD also, uncles, aunts, other members of the extended family who may have attention problems. So we understand there to be a biological component. And that's interesting because, again, it helps us with our understanding of it as a disorder. It's not somebody's fault. We know there's a biological component. It has a psychological component in that each child who has ADHD has his or her own personality. And the child is a person first, and then they happen to have this disorder. But their personality and their temperament is also going to determine how ADHD looks in them. And a social component. So each child lives within a family and goes to school and has a group of peers. The way in which ADHD shows up in a child may be affected by what's going on in the family, by school-related stressors, by complications in peer relationships. So it can make it better or worse. Like sometimes I find when I'm looking at the kids' report cards, I find some years they have a teacher who is a perfect fit, and that the child does well in that year. But other years they have a teacher who's not a good fit, and in that year they don't do as well. So we know that the environment can also have an effect on how ADHD shows up in a child. So the defining features are simply inattention, distractibility, and impulsivity, doing things, acting before you think, and hyperactivity. Those are the three main defining features that we think of when we're thinking of ADHD. When we're looking at that, we know that it's going to look different. Like some of those things are going to look different in a child depending on how old they are, and we're going to, like a 2-year-old level of activity, you expect a 2-year-old that may be very, very active, but maybe a 6 or 7-year-old, you don't expect that same level of activity. So we're looking at how it may change by age, and again, according to just where the child is at developmentally and emotionally and that sort of thing. So can we go to the next slide? And then the next one. We're looking at the diagnostic criteria. Those are the three main features that I mentioned, but we do talk about formal, to get a diagnosis. It's not just, the kid's overactive, so he has ADHD. There's really a somewhat formal process that we go to in order to make a diagnosis. And we use the thing that we use is called Diagnostic and Statistical Manual, and it's the 4th edition, and the TR means text revision. It's a big fat manual that kind of tries to help us all have common ground when we're talking about ADHD. So professionals across North America, at the very least across North America and some European countries, will use this set of diagnostic criteria. So we're speaking the same language when we are talking about ADHD. So the next. What the DSM-IV requires us to think about when we're talking about ADHD, it has 3 different categories of behaviors that might let us know a child has ADHD. First of all, inattention, and that's not being able to, just inattention. And I say for myself, if there's anything that matches me, some of that matches me. Not all of it, but some of that matches me. And so, not being able to pay attention to details. So a child doing some math, won't notice if it's a plus sign or a minus sign. Years ago I was working in a bank, and there were many, many details that I overlooked, and I did a very, very bad job as a bank teller. And I ended up losing my job halfway through a summer, which wasn't very, very great. But it was just because of just knowing exactly what the procedures were, but just not being able to pull it off on a consistent basis. Not being able to pay attention for very long in both work and play activities. So the child that Chris just described would be one who just couldn't stay put with a single set of toys, went from toy to toy to toy, or game to game to game, or that sort of thing. And seeming not to listen when they're being spoken to. Child might just, you might think that the child is just ignoring you, but really he may be zoned out, maybe thinking of his own thoughts, maybe have his mind off in another place. He's just not present. He's here, but not here. And may not follow instructions or complete tasks. Sometimes I watch kids in classrooms and the teacher gives everybody a set of instructions and most of the kids pick up on it, but then somebody just drifts over here and goes to sharpen a pencil and can't get started, just cannot get going with tasks. So the next, okay, so then continuing inattention. The child may have difficulty organizing tasks or activities, may have a messy room, messy locker, messy desk. Avoid tasks that require sustained mental effort. And sometimes, for example, when I'm doing some assessment with a child, I'll see some kids will stay on task for just stay on task and they can persist and try. And other kids they just don't want to work through it. They don't want to think their way through what might be going on. So they just lose interest. Losing things is so often. You don't have a pencil, you forgot your binder, you forgot your notebook. Just losing things. My son, when he was a little kid, I used to do a weekly sweep of the lost and found at school because he just would not hang on to the things he needed to hang on to, and I would always go and retrieve the things that he left behind. Being easily distracted by noises, and that can be, and I find for myself very hard. If I'm working in my office and there's a conversation going on in the hall, I always end up getting up and closing the door because I just can't think. Or if I'm trying to talk and there's an announcement going on, I can't stay on the conversation. Just being forgetful. So often, like intending to do something, and you go upstairs, you intend to get this, and you get sidetracked, and so you just get distracted. And being forgetful about what your purpose was. So next one. Again, now we're on to, and the thing about when you're looking at a diagnosis, it is, you need 6 out of 9 of those, let's say, diagnostic criteria in order to qualify for a diagnosis. And as for the next 2 slides, we'll also need 6 of 9 of those behaviors to qualify for a diagnosis. So looking at hyperactivity, through the fidgetiness, and so it's much more physical. And I will say that kids who are hyperactive, very, 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 very active, are the ones who are going to come to the attention of others earlier than kids who are inattentive. So that sometimes I'm sitting in an office and somebody's leg is bouncing away, or a pencil's being jiggled, or somebody's even, actually sometimes I hear speakers and they're jingling their coins or their keys in their pockets or something like that. So that's just kind of physical movement. For a child who might leave their seat in school when they're not supposed to, they just get up and go. I think the whole idea of being on the go and being active as if driven by motor. For some kids, you just sort of see they're almost at the mercy of their own bodies. They're at the mercy of, they just can't settle down. They can't take a deep breath. They can't tone it down, and they're going. So, and the whole thing about talking excessively, that is interesting because quite often girls with ADHD may not have quite all of that physical activity, but girls with ADHD may chatter, just keep talking. And so that's another version of hyperactivity. Okay, so then kind of coupled with that is impulsivity. That's children who blurt out answers to questions before the questions have even been asked. So quite often in school, the child might put up their hand to answer a question, but they're not even answering the right question because they haven't been able to contain themselves just in order to listen and wait to see what is being asked. Having difficulty waiting for a turn, and that might be lineup, somebody who always has to be first in line, or somebody who can't wait to wait their turn in a game, and being interrupting or intruding on others. almost oblivious to the fact that another person is there and has something that they want to say. And I think also with respect to impulsivity, I sort of say that I call it like almost the proof experience. Like the child is not just going along in a fine mood, but all of a sudden they're doing something they're not supposed to do. And poof, they're just done. And it's almost like they've just done a behavior and they don't even know that they've done. They don't even know that they haven't intended to be bad, so-called, but somehow they're in trouble. So, okay, the next one. So then, for diagnostic criteria, again, if we're talking about a formal diagnosis, the symptoms are severe enough that they are interfering with how a child is functioning at home or at school or in the community. And I say for me, I sort of jokingly say I have these little features of ADHD, and I probably do, but it doesn't interfere enough. I have enough coping strategies so that I wouldn't qualify for a diagnosis. It's not as impairing. And then the symptoms, again, for a formal diagnosis, should be present before a child is age 7, even if they're not recognized as symptoms of ADHD as such. And if those, everything's been perfectly fine, and then all of a sudden these things occur at a later age, we might be looking at a different explanation. And quite often, if a person gets a diagnosis, they get it, and when you look back, you see that there's been a long history that hasn't necessarily been recognized or understood. Okay. So, when we're talking again about the formal diagnosis, so there's 3 versions, and one of them is called ADHD, predominantly inattentive type, or ADHD, predominantly hyperactive impulsive type, or ADHD combined type. So, and those are somewhat self-explanatory based on the things that I've just mentioned. I should mention, the way we're doing this tonight is we're going to do our 3 presentations, and then we're going to ask you to hold questions, and if you have questions, think about them, and then we're going to try to just have an hour and a half, 45 minutes for questions at the end of our 3 presentations, okay? And that's so that we kind of cover the material that we're hoping to cover. All right, so now so I've talked about those, the impact of inattention, I've talked about those diagnostic criteria, but partly I want to understand that those things do affect your life. And they do, and we talk about impairment, they do screw up your life to some extent. They may. So that's it for inattention. Go to the next, this slide. So when does ADHD first appear? I think basically the general rule is the more severe it is, the more obvious it is earlier on. I think especially when I think about modern ADHD, some kids are coping perfectly fine at home or before they go to school, or they're at home after in the evening, that sort of thing. Get to school and there's a certain set of demands that are made at school, and that makes the symptoms more obvious. And mild ADHD, some people don't even recognize it until go to university. And I've met a number of parents who, after their child is diagnosed, they say, okay, now I understand what's going on with me. So they may have had a milder version and they have developed coping strategies, but it's been milder than they've been able to cope. Okay. So now we'll go to the impact of the next slide. Okay. So what I was trying to say before was that those symptoms do affect a person's life and cause complications in a person's life. So for inattention, and thinking about it in school, things don't get done. It may seem like the child just can't get started, doesn't take any initiative. They may seem a little bit spaced out. They may appear to be uncooperative. It might be if they're asked to do something, they go upstairs, or they go to the room and they haven't done it. They're asked to tidy the room, they're asked to get ready for school and haven't done it. It may appear as though they're being deliberately non-compliant, but really it's just so they may seem uncooperative, but really it's an impact of the inattentive part of ADHD. And often associated with underachievement at school. So the next slide. Please. And then impact of hyperactivity. And that's where kids accidents happen, toys get broken, things get spilled. always getting in trouble. Again, they're not intending to be in trouble, and they're not intending to be malicious. Like it's not anger-based, or it's not I'm going to get you based. It's just they're just getting into trouble. But especially with very, very, very active kids, it may be exhausting. It may seem to be oblivious to the fact that they've broken yet another piece of equipment and don't seem to care. They just seem to be a little bit oblivious to those things. So hyperactivity can also have an impact, and it can certainly have an impact at school, and can certainly present challenges for parents. And so then impulsivity. Sometimes when I talk about that impulsive behavior, sometimes behaviors seem inexplicable. All of a sudden the child has done something they're not supposed to do, and they don't know why. They just ask them, and they don't have a single clue. They just did it. Part of the thing I'm thinking of is I talk about the concept of stimulus bound. You're just responding to what's here and now in the room. And one example I give, so someone's bending down to pick up something from the floor, and all of a sudden the child sees its butt out there, and he gives it a little kick or gives it a little shove. So it's like that was unable to restrain himself. That's just an impulsive act. And sometimes when kids are very impulsive and they're always getting into trouble, they may cover up. They may cover up just to try to get out of the trouble they are now in. So they might try to lie or to make an excuse or just pretend it didn't happen. So that adds another set of complications. Now, I'm going to go through the next number of slides fairly quickly because time marches on really quickly. And so I'm just, as the next several slides I'm talking about the impact on children and the impact on parents. For kids, it's like a little bit of an emotional roller coaster, and they're in trouble and they don't know why, and they're getting negative feedback and they don't know why, and they don't always understand why. They seem to be receiving criticism when they're not achieving at school. All of that affects a sense of self and a sense of well-being. Both kids and parents may end up being worrying more, being more bewildered, blaming themselves, being more distressed. Parents like them may use parenting strategies that work perfectly well with one child and don't work with another. So then parents might question what the heck is going on, or why things are not being successful with this child. Sometimes, and I wonder if you just go ahead a couple of slides, please. Sometimes, in almost every family, parents are not exactly on the same page with respect to parenting. And sometimes one is going to be more strict and one is going to be more easygoing. And quite often, if there's a child who's not responding to typical parenting practices, then the one who's more strict gets stricter, and the one who gets more lenient gets more lenient and more accepting. And then the parents try to conflict. They conflict with each other and disagree with each other and can't come to terms with what exactly would be the best strategy. So that is a pretty profound effect. I always think that if parents are on the same page, it's easier to be on the same page with kids who are tranquil and easygoing and do what they're supposed to do and all of that stuff. But when it's not happening the way you want it to, that can cause conflict and a bit of confusion and bewilderment. I think more often, and then going to the next slide, sometimes it's possible to think of a child as deliberately manipulative. And honestly, I remember a little boy in our neighborhood when my kids were small, and there was a little boy that before I knew any of this stuff, really, there was a little boy who we had just general guidelines for how you played with each other and how you played in the garden. And one kid, no matter what you did, he did the opposite. And I now understand that he had ADHD, but I was pretty annoyed at him some of the times just because I saw him as just like, why can't you just do that? I just asked you for this, or something like that. So it's easy to kind of get caught up in being annoyed with if you're not fully understanding what's going on. And just a couple of examples, a couple of books here. One book that is for teenagers that is called, and it's a little bit of an older book, it's a 1997 book or something, but it's called I Would If I Could. That's from a child's point of view, saying, if I knew how to handle all of these things, I'd be handling it. I'm not intending to be a bad kid. And then another book that's for adults that's called You Mean I'm Not Lazy, Stupid, or Crazy? And the reason for that title too is that for so often if people haven't understood what's going on with them, they start to think of themselves as lazy, stupid, or crazy. So all of that's by way of saying that we talk about it as it's like a no-fault brain disorder. Something's happening, and the more we understand it, the more it helps us to get a handle on what's going on. Now, had lots of stuff that I'm not going to say, but you may be able to ask questions. I'm talking about an assessment process. I'm thinking about like teachers, nurses, friends can kind of can maybe alert you to say, well, I wonder if your child has ADHD. In terms of getting a formal diagnosis, you have to go to a physician, a family doctor, a psychiatrist, a pediatrician, or a psychologist in terms of making a formal diagnosis. But other people can alert you to the possibility that this might be what's going on. And I also want to say sometimes ADHD is confusing. And I'm going to skip ahead to this called ADHD and other disorders. So that's okay. So just note, it's not always as like I went through those diagnostic criteria and makes it seem easy, but really it's not. We have to kind of figure out if those diagnostic criteria are met and if ADHD is the reason for them. Sometimes ADHD can masquerade as other disorders, but sometimes people can have more than one disorder. And sometimes what looks like ADHD in a young child, as we get more information, as the child gets a little bit older, we find out that there's something else going on. Sometimes as kids, they start out having ADHD, and when adolescence comes, you may sort of unfold that maybe they've got Tourette's, or maybe they've got bipolar disorder. Something else might be going on. Go to the next slide, please. So, ADHD, kids with ADHD, not all, but more often, might get a diagnosis of ODD, and that might mean they might be more argumentative, more non-compliant, or they might, there's a little bit higher risk of having a diagnosis of conduct disorder, which means of getting into trouble more often, just lying, seeming to cover up things, seeming to be indifferent to the impact of all of that. I'm pretty cautious about using those terms, but sometimes those terms end up in people's reports. And so there is a slightly higher risk of ODD and conduct disorder being associated with kids who have ADHD. ADHD can co-occur with anxiety, or ADHD can create anxiety in a child who wants to do well, but is always getting into trouble, wants to do well at school, but is they forget things, they just don't live up to their own expectations. And ADHD may occur with depression, partly because of chronic frustration, being the recipient of criticism, feeling that you're always screwing up. All of those sorts of things can undermine a person's sense of himself and self-confidence. And I'm going to skip the next one. And then I'm going to go to the next one. I don't want to sound like a total voice of doom and gloom. The idea that also a person with ADHD can have a whole lot of really positive qualities in terms of having energy, being funny, being outgoing, being observant, being warm-hearted, wanting to do well, being fun to be with, all kinds of really good qualities. So we're kind of, when talking about diagnosis, you're focusing about things that are not going well, but I want to make sure that people remember to keep an eye on all the things that can go well and do go well with kids with ADHD. And then to the next slide. I'm sorry I ended up having to rush through all of that. The next slide is so Gladys Bender, who's our nurse therapist at Lutherwood, is going to talk about medications. And after that, Lynette Todd, our youth worker, is going to talk about parenting tips and useful strategies.
So the decision to put your child on medication for ADHD is probably one of the more difficult decisions that you will have to make when your child is diagnosed. And I just have to give you a disclaimer that I am not here representing any drug company tonight. I'm not sponsored by any drug company, so there's no money in it for me that way. But I'm here tonight to attempt to give you some facts and some information that will help to give you an informed, be able to make an informed decision if there has been a diagnosis of ADHD and medication is a possibility. Okay? As Chris mentioned, I've been working in children's mental health now for close to 20 years, and so I have come across a lot of questions that families have guided and helped and journeyed with families who have done medication trials with their children with ADHD. And so I've come up with a list of questions that are the most common ones that families will have. So if I haven't addressed your question, please save it for the end when we do have a question period. So first of all, who should take ADHD medications? Which are the children that should consider it, and also having the parents be on board with that? Well, first of all, as Pam went into a great in-depth description of how an assessment is necessary and a diagnosis to be able to be sure that that is what you are dealing with your child. So you want to have that first of all. And then when you have tried all the other things like healthy diet, other complementary approaches and strategies, and it still is not enough. You feel like your child is having trouble and starting to show things like slipping maybe academically. There might be signs that socially they are like the little boy that was at Chris's house, having some difficulty socially in working with friends and keeping friends. And as a result, maybe their self-esteem is starting to lower. You can go on to the next slide. And also, one of the next steps that we very often see that we hope not to see is when they start self-medicating and getting into substances that really do help them concentrate, but not in a good way long term. So, I see kids who are getting into energy drinks, pop, drinking 1 liter or 2 liters, maybe even 3 liters of pop a day that has caffeine, getting into nicotine, those kinds of things. They are a stimulant that in the long run they are helping them initially, but long-term use is not going to help them. And then finally, as a parent or the adolescent, you have to weigh, are the benefits going to outweigh the disadvantages of not having them on medication? And I'll help walk you through some of the things to consider that. ADHD medications really have been around for quite some time. In about the mid-1930s is when some of them started coming out. So they really have a long track record and have been investigated quite thoroughly, which is often not the case for psychotropic medication for adolescents. So before we can fully understand and appreciate the list of medications, I want you to think about on any given day how there might be a day where you feel you're up for whatever that day and you have a positive outlook no matter what. And then another day you get up and the cup is only half full and it's only half full all day. And those are the kinds of things that these 3 brain chemical messengers will influence that attitude or how you feel on that day as to whether you feel you're ready to cope with the day or not. And so the cause of inconsistency in varying degrees of brain chemical messengers working in the brain, these 3 primary players will have a lot to do with how you can manage. So that's the same for all of us. Now, when someone has ADHD, the thing that really can influence someone is the first 2, that's the dopamine and the norepinephrine. And I don't expect you to remember those, but I mentioned them tonight to just kind of reinforce the fact that Pam made, is that it really has something to do biologically that is going on in the brain. And when these messengers are prevented from circulating through the brain properly as they are in ADHD, then that's what prevents, or that's what causes the impulsivity, the inattention, all the things that we see with ADHD. So the purpose of medication then is to try to keep these messengers circulating through the brain and giving you the benefit of being able to have a filter, to be able to put the brakes on, and be able to manage in the regular life situations. There are two main categories of medications that we use for ADHD. Those are the stimulants and the non-stimulants. So I'm going to talk about both of them. There's many more medication in the stimulant category. And those are the ones that have been around so long. And they're basically just two types of medication. And those are the methylphenidates or the Ritalins. And then there's also the amphetamines, which are the dexedrins. So of the choices, usually you will find that your physician that you go to will probably start with the Ritalins. That's very often the case. And so in the last 10 to 15 years, I would say, and some even more recent than that, there have been a lot of changes to the medication that at one time, Ritalin was a pill that was short-acting and you had to give 3 or 4 times a day. Now what they've come out with is a variation of that very medication, both the dexedrine and the Ritalins, that is a longer-acting. But not only is it long-acting, it's one that looks after being secreted at the times when you need it most. So they're very, technically they have designed these medications to really be able to give you the medication when the child needs it most. So for example, we have Concerta. You may have heard of that one. That's been on the market now for several years. But one of the concerns is that the Ritalins and the dexedrins have some street value. And we know that they are being used on the street and sold so that people can use them that have addictions as well. And that is a concern that I'll talk about a little later. But one of the things that the drug companies did then with the bifenton, for example, and the Concerta, is made it into a hard capsule so that it isn't easily crushed and it's not as near high risk of abuse on the streets then. And there's some medication on the outside of the capsule that as soon as someone takes it, they start absorbing the medication. Then there's a release on the inside of the capsule that starts releasing throughout the day, and it should last usually 7 to 12 hours so that the youth doesn't have to take it 3 or 4 times a day, because that's where it became problematic for a lot of parents having to help their kids try to take it as often as they need it. One of the more recent ones, Vyvanse, that's an amphetamine, it is a dexedrine, and bifenton, both of those medications are probably the most recent ones now that we see on the market. They're capsules with little beads inside, so if you have a child who has trouble swallowing medication, you can open up the capsule, they can put it on a spoon of applesauce or yogurt, and they can take it that way, and it's still going to have a slow release throughout the day. So the companies have been listening to families who are saying, you know, this is what we have trouble getting our child to take the medication and why they're concerned, and they've looked after some other issues to try and help them. But basically, there's still only 2 kinds of medication. The non-stimulant medication then are, there's very few actually. Strattera is the main one that is specifically for ADHD. And it does have, generally speaking, we use it for youth who may have some other presenting problems. And so it's not usually the first drug of choice for someone with ADHD. So if someone has Tourette's, for example, or there's concern that there is a family history of other mental health issues, and you're concerned that stimulant medication could cause them to develop or to precipitate some of these other symptoms, then you might consider something like Strattera first. But that is one that is a long-acting, non-stimulant, again, does not have any street value, so that might be another reason to use this one. And then I mentioned clonidine, which you might know, be more familiar as a medication that lowers blood pressure for adults, but also in very, very small doses. If you have a real hyperactive component for you, this is what helps to channel some of that adrenaline and make sure that it's not pouring out so furiously as it does in ADHD, so it helps to channel it a little bit better. And bupropion or Wellbutrin is another one. Now the one disadvantage of all of these medications is that they have to be taken regularly and the effects won't happen right away. So, you'll have a child that's on the medication for several weeks before they're going to see an improvement. And with someone with ADHD and parents of children with ADHD, that's a long time to wait. So that's another reason why we often start with the stimulants first. Okay, all right. So in terms of the effect of the medication, you should be reassured. The American Pediatric Society has stated that in their standards of practice that up to 90% of adolescents who are treated with medication for ADHD do have some benefit, and they will find a medication that works for the ADHD. Sometimes it takes a while, and sometimes the dose needs to be adjusted. So there is a trial that you have to go through to get to the right medication and the right dose. But it is hopeful to know that the majority of adolescents that are put on medication do end up having good results. Okay, next slide. So are there times when my child can take a break from medication? This is often something that parents or that children will ask, because in the past that was a fairly common practice, because the medications, often one of the side effects was that it affected the appetite and caused them not to eat very well, and as a result they didn't grow very well. And so the recommendation was to give them a break on weekends. With the new medications now, the way they are manufactured and in the capsule form, and there are things that we can do to work with them that they don't affect appetite the same way. So, and we also know that ADHD is not just in school, it's in your socializing life with your friends, with your family, with the activities and clubs that you're in on the weekend. So the medication really, we're much more encouraging now that children and families continue the medication all the time. And it's especially true for teens who might be wanting to think ahead about getting a license. There is some talk too about somebody who is diagnosed with ADHD. Are they going to start looking at whether or not they are taking the medication before they can drive, so that because the incidence of car accidents, insurance companies are looking at this, and the incidence is much higher with ADHD if they're not medicated. So it's an important factor there that an adolescent be medicated if they are serious enough. Okay, now, how will it make my child feel? Well, usually what happens, the youth will find that they might not initially feel like there's a big difference. So you need to make sure that all the people involved with that child are checked in with. So what is the teacher saying? Because usually the teacher will notice a difference within 60 to 90 minutes after taking the medication for sure. You usually get a stimulant medication result within half an hour to an hour, 90 minutes for sure. So there should be some benefit. So with those medications, the first day there should be some results. Now, when you're starting a medication trial, you may start on a low dose and gradually increase it. So if you don't get results right away, that doesn't mean that that medication doesn't work. It means that the dose probably isn't high enough. And usually, physicians will want to try something too low first because you have less side effects then. And you gradually increase it until you get to a dose where you see the results of it. And then once you see the results, you try that dose for a while. If they've gone that route and they're still not getting improvement, then you may need to switch to another medication. So it's important that you check in with all the people that are involved with the child and see what kind of results, what kind of effect they think they're getting. And those are the things that you need to feed back to your child then. Because, compare, for example, how much homework did they get done before they were on the medication as to compare it to after? Or how much were they able to stay in school for the whole class or the whole day? Or did they get kicked out, beforehand? And do they still, or are they able to keep attention? Those kinds of things are important. So one of the things to watch for is to make sure that the child's basic personality is not changing. Okay? When you're on an ADHD medication, it should treat the ADHD, but as Pam said, sometimes there are coexisting kinds of issues or concerns, diagnoses that haven't been made yet. And if you have a child who has some of these other things that weren't diagnosed, when they're on a stimulant medication for ADHD, it might speed up or precipitate these other things from happening. So if you see a personality change, then that's something you need to go back to your doctor and make sure you let them know about that as well. The other concern around addiction, as I mentioned before, is that very often, because the stimulant medications do have some street value, some of them do, that's another thing that you would want to be concerned about. And as a parent, take time to make sure you're monitoring the medication, that you're locking it up and we're counting, and have some way of making sure that the medication isn't going faster than it should. Now, parents worry that if they're on these stimulant medications that it may cause an addiction, but actually, when a child is on and started on the medication, when they're serious enough, moderate to serious enough, with the symptoms, that generally speaking, they won't try. There's less chance, less risk of them trying other substances that will help them to focus, and all the substances that I mentioned before. And there is a strong correlation between those that aren't treated who also get into substance use, especially with marijuana. And what that can do initially is help to reduce some of the inattention, the impulsivity initially, but not the inattention. It can actually get quite a bit worse, we see. And so we want to make sure that they understand, it might feel better and they might feel they can focus initially, but then in the long term, it gives them more problems. Next slide. So the kinds of side effects that are fairly common that we can work with, that we can do something about, are the things like loss of appetite. Sometimes it can affect the sleeping, but again, you have to make sure that you're giving it early enough in the day and not giving it too late, because the medication will last 12 hours. Then that might, if your youth sleeps until 12 on the weekends, and you give it at 12 when they get up, they're not going to settle before midnight that night. So work with that, make sure that you know how long it lasts, how early it should be in their system, that type of thing. As far as appetite, that often doesn't last very long anymore with these medications because they're in the capsule form. As long as you make sure that you give them with food, that's a really important factor for it. Headaches might be a little bit in the beginning. Most of these side effects are things you can work with and usually go away if they don't last. And some people complain about a rebound later in the day. So when their child gets home from school, they might find that the behavior, the impulsivity, the inattention might increase again. And it could have to do with some of the energy they put in to try to concentrate in school along with the medication, but it could also be that they're one of the youth that the medication is wearing off after 7 hours instead of 12. And so they might need an additional dose, or they might need an increase there. So those are all things to work with. Okay. These are the side effects that you want to pay attention to, that you want to get them right back to their doctor. If there's anything like a rapid heart rate or any kind of increased agitation and euphoria, if they're acting really silly and giddy, those kinds of symptoms, as well as tics, any of those symptoms, you should take them right back and make sure you have them see their doctor right away. And when is it finally okay to consider going off medication? Well, I've made a list here of criteria. And because that's often the case, often people will want to know, kids will want to know when they can stop taking their medication. It's not something that, the medication is not going to cure the ADHD. It helps them manage the symptoms. And so, there are times where you might find that they're not wanting to take the meds, they want to go off of them because they think they've got the strategies in place that they don't need them anymore. But I've listed four things here that I want you to consider before you would have them go off of their medications. So if they're symptom-free, for more than a year on their medication. If the child is doing better and better, but the dosage hasn't been altered, and if their behavior is appropriate despite missing a dose or two, or if your child has developed a newfound ability to concentrate. So basically they've matured, there might be a chance you can talk to their doctor and see if this is the time where you can try going with that. And finally, how do you explain ADHD medication to your child? Well, I think the example that was given before with all of mental health concerns, if you had a medical concern, you wouldn't think twice about going for, if you thought your child was diabetic, if you thought that you needed an optometrist to prescribe you eyeglasses, you would go and get those things checked out. So this ADHD is similar, okay? It's something that you might be able to manage, but you might really do so much better with the use of medication. And so it's something that might be worth a trial if you're having a lot of difficulty in the other areas of their lives. And so you think of it as a support and describe it and make sure that your child is involved in that decision.
Right, so Gladys did a perfect introduction for me when she was talking about explaining medication to your child. I'm going to talk a little bit first about when you're talking to your child about ADHD. So make sure you're telling the truth. So educate yourself, put it into your own words, put it into words that your child can understand, be honest and clear about what ADHD is. Use accurate vocabulary, so don't make up words or use words that are inaccurate to describe it. Answer questions your child may have and encourage them to ask you questions. And if they're asking questions that you don't know the answers to, that's fine to tell them, I'm not sure, I'm going to go ask the doctor or ask the teacher, find someone or a book that would know the answer and go back to them and give them the accurate information. So educate your child about ADHD. Maybe you could give some positive examples of role models, whether it be people from history or people that they know personally. So for example, Albert Einstein had ADHD, Robin Williams has ADHD, and Bill Gates has ADHD. Maybe their dad or cousin or aunt or uncle might have ADHD. Those would be some personal examples. Let others know that your child has ADHD. So the idea behind that is that there's nothing to be ashamed of, there's nothing to hide. It's perfectly okay that someone has ADHD and they have different abilities. Coach your child on how they can answer questions that their peers or other people may have and ask them. You can role play that or give examples of questions others might ask. And the final thing is to be cautious not to use ADHD as an excuse, because we still need to have our children be held accountable for their actions. So from that, we're going to move into some parenting tips. And the first one is stay positive. As a parent, you have control over many of the factors in a child's life, so staying positive will give them a positive influence. The power of a positive attitude is your best asset for helping your child work through their challenges. Keep things in perspective. Remember that your child's behavior is related to a disorder. Hold on to a sense of humor. What might be embarrassing today might be a funny story a few years from now. Don't sweat the small stuff and be willing to make compromises. And believe in your child. So maybe make a list of everything that's positive or unique about your child and make that a ritual so that you're doing that all the time and you can remind yourself, what are the positives here and how can we work together? The second tip is staying healthy yourself. It's not an accident that I put this near the beginning, because if you're not looking after yourself, it's going to be hard for you to care for others. So when you take care of yourself, you're better able to take care of your child. You're also a role model for your child, and you're a source of strength for them. Take care of yourself, so eat right, exercise, find ways to reduce stress, whether it's relaxation, taking a bath. If you get sick, acknowledge it and look after yourself, get some help so that you can look after yourself, look after others. Seek support. You're not alone. Talk to your child's doctor, teachers, a therapist. Maybe join a support group so that you know that you're not alone. It's sometimes a good forum to get advice, give advice, a good place to vent your feelings and shared experiences. Take breaks. Family and friends can be wonderful about offering to babysit, but you may feel guilty about leaving your child. Take them up on the offer and maybe chat with them about the best ways to deal with your child. Number 3 is creating a quiet place. So make sure your child has a quiet, private space. And the one thing I want to point out about this one is make sure it's a positive space. So you don't want it to be the same place where you might send a child for a timeout. You want it to be a positive place where they can go and feel good that they are making their own choice about removing themselves from the situation. Number 4 is be neat and organized. So set up your home in an organized way. Make sure the child knows that everything has its place, and role model it as well. So keeping your house neat and organized. Setting clear expectations and rules. Children with ADHD need consistent rules that they can understand and follow. So make the rules of the family and the household clear and simple, and maybe write them down, hang them up somewhere where everyone can be reminded of the same things. Praise and use positive reinforcement. Sorry if I'm going too fast, but I'm just aware of the time. Be on the lookout for good behavior. Praise it, and it's especially important for a child with ADHD because everyone's noticing the negative things, and they're often getting correction, criticism, and complaints about their behavior. So whenever you can find something positive to comment on, it helps build them up. A smile or positive comment or other reward can improve the child's attention, concentration, and impulse. Reward your child for small achievements that you might take for granted in other children. Using rewards and consequences. Come up with an organized system of rewards and consequences, and it's important to explain what will happen when they're following the rules and what will happen when they break the rules. So stick to your system and follow through each and every time. When you're using rewards, reward with privileges, praise, and activities. Change rewards frequently because sometimes children with ADHD lose interest quickly. Maybe make a chart with points or stars for good behavior so your child has a visual to look at. We know that ADHD children can be very visual learners, right? Immediate rewards work better than a promise for a reward in the future, but sometimes small rewards leading to a big one also can work, especially with teenagers, I find. And always follow through with the reward. So if you promise something or tell them that they're going to earn something, follow through with it. When you're using consequences, consequences should be spelled out beforehand, so in advance, and occur immediately after the child has misbehaved. You can try timeouts or removal of privileges for consequences. Encourage movement. So children with ADHD often have energy to burn. Organized sports and other physical activities will help them focus on specific movements and skills. Physical activity also improves concentration, decreases anxiety and depression, and promotes brain growth. So important for other reasons as well. Exercise also leads to better sleep, which I'm going to get to in a couple of slides. Find a sport that your child will enjoy and suits their strengths. So something like baseball, where there's bench time and they're waiting, might not be ideal for a child with ADHD, but hockey or basketball, where they're always on the move, always running around, might be, if that suits their strengths, that might be something more ideal. Kids with ADHD might also benefit from martial arts or taekwondo or yoga, because this enhances their mental control while they're working out their body. Keep kids busy. So idle time may intensify their symptoms, but if they become too busy, they can become overwhelmed. So finding a balance between keeping them busy, but not throwing everything at them all at once, so they become overwhelmed. Try not to use television, computer, or video games as time fillers. As most of us have probably noticed, TV and video games are getting more and more packed with violence, and this can increase a child's symptoms if they have ADHD. Encourage sleep. So insufficient sleep can help make anyone less attentive. And kids with ADHD need just as much sleep as their unaffected peers. And they may not be getting it because they, attention problems might be distracting them from being able to fall asleep. Overstimulation. So some strategies to help your child fall asleep is decreasing television time and increase the child's activity levels, and exercise during the day, and decreasing overall screen time. So by screen time I mean television, video games, computers, anything that involves a screen. Eliminate caffeine from your child's diet. Cola drinks, energy drinks, and chocolate have a lot of caffeine in them. Use relaxation tapes as background noise. And also children with ADHD sometimes find white noise soothing, so just a blank station on the radio. Creating a bedtime routine and sticking to it. Some other strategies that aren't on here, but I'm going to just quickly mention is creating a buffer time to lower down the activity level an hour or so before bedtime. So whether it's coloring, playing quietly, reading, spending minutes to cuddle with your child. This will build a sense of love and security and provide them with time to calm. Use lavender or other aromatherapies. And the benefits of green time. So research shows that children with ADHD benefit from spending time in nature. It shows that kids with ADHD spending time in a park with grass and trees have a greater benefit and are able to become more calm than if they were at a playground that's concrete and no nature. So that was an interesting fact I found. Helping your child eat right. So diet is not a direct cause of ADHD, but food can affect any child's mental state, which in turn affects their behavior. So all children benefit from fresh foods, regular meals, and staying away from junk food. The next one is helping your child improve their social skills. So it's hard for children with ADHD to learn social skills and social roles. So it's important for you to try help them become a better listener, learn how to read people's facial expressions and body language. So speak gently but honestly with your child about their challenges and how to make changes. Role play various social scenarios with your child. And be careful to start playing mates with your child with a similar language and physical skills. And invite only 1 or 2 children over at a time. So that kind of goes with the inattention and being too chaotic for them. Watch them closely and have a zero tolerance for hitting, pushing, and yelling in your house or yard. And make time and space for them to play and acknowledge it when they are playing well with their peers. Teach your child how to make friends. Children with attention deficit disorder often have difficulty with simple social interactions. They may struggle reading social cues. They might talk too much, seem to come off as aggressive or too intense. And their relative emotional immaturity can make them stand out among other children, and that in turn might make them an easy target for teasing. Establish structure and stick to it. Children with ADHD are more likely to be successful if they know what to expect and when to expect it. So if it's predictable place and predictable timing. So follow a routine. There will be a time and place for everything, such as meals, homework, play. So maybe homework happens as soon as they come home from school for the first half hour, and that's how it is every day. So they know that when they come home from school, they know what to expect. Using clocks and timers. Consider placing clocks throughout the home with a big one in their room, and then allowing them time to do what they need to do. It might take them a little longer to do something, or it might take them less time to do something, depending on what it is. And use a timer for homework. We use this in the classroom all the time too. If we know that they can focus for a 20-minute period, we'll set an egg timer for 20 minutes. When that 20-minute period is up, then they get a break. Simplify your child's schedule. It is good to avoid idle time, because this might be time where they can get themselves wound up. So again, having a balance between how many after-school activities they have. You don't want to overwhelm them, but you want to also keep them busy. At the end of your package, you don't need to turn to it right now, but I've included some tips on structuring your home and the importance of structuring your home, and then a couple examples of like a morning routine checklist and a weekly schedule. So those are just some examples and extra information. So in regards to their education, you and your child should learn as much as possible about the diagnosis, because the more you know, the more you can advocate for your needs, you'll know your strengths, and you know what treatment will work best for you. So also educating the people around you, so your families, neighbors, teachers, anyone who's going to be involved in your life and your child's life should know so that they know best how to handle that. And ensure that your child is able to do some explanation, especially as they get older, they're going to need to advocate for themselves. That's one of the big focuses we have with our teams that we work with, is we try to teach them about what's going on for them, how they feel about it, and how to explain that to other people. When your child is able to speak up for themselves, they feel more empowered, and in turn creates a better self-esteem and self-confidence as well. So classroom tips for your child. So sitting at the front of the classroom. So depending on the size of the classroom, maybe staying away from windows and doors too, just to eliminate distractions. Taking pride in the things that they do well. Using tools that stay organized. So whether that's using computers, using agendas, making lists, using textbooks, writing down appointments. I really encourage them to have like a day timer or agenda, depending on what the schools use and what you can communicate between school and home. Being a part of their individual education plan. So an educational plan needs to meet the needs of your child, and there are three main components. Oops, we passed it, but the academic component might include reading and writing, one-on-one instruction for skill areas, chunking, modifications, so maybe the quantity is modified or the timelines are modified, and using technology. Behavioral components might include reinforcement, structure, and environmental concerns, and the social skills component is about social skills instruction and what other social skills training they might need. Talk with the teachers about their child's ADHD and work together to be sure that they are learning in a way that is beneficial to them. Have your child let their friends know. So sometimes with friends, they might blurt out things or say things or do things impulsively, and it's okay for your child to let their peers know what's going on, and for them to apologize and explain why they may have done that, and apologize for maybe hurt feelings that might happen. Turn off email, instant messaging, or phones when you're doing homework or other tasks. This will again help with reducing distractions. And practicing relaxation and meditation techniques to relax and focus. So I'm just going to quickly sum up some of the things that all three of us have talked about. So recommended intervention strategies might include getting an accurate diagnosis, using medication to level the playing field as one part of the comprehensive management, receiving psychoeducational information about ADHD to the child that has ADHD and to the family, review expectations, become more realistic in recognizing their strengths and weaknesses, reading, attending workshops, and joining appropriate support groups can provide a place, again, to discuss and to share with other people that might be going through the same things. Learn strategies to manage problems. And a really important one is it will be beneficial for individuals and family members to reach a level of acceptance that enables you not to anticipate a cure for ADHD, but to be able to cope and manage with the problems that might be presented with that, and then building self-confidence and self-esteem. So I know I rushed through that, so